Page 2 now, Obamacare in its heavy hand. All Americans must have health insurance now. That's the law. In fact, that's the only way this thing can work. The young subsidize the old, and the wealthy subsidize the poor. Classic socialism, classic redistribution of wealth. And as a result, health care premiums are skyrocketing. So much for the free market medicine.
It's been a wild, wild success, and about 4 years ago, having seen the difference in prices between the surgeries that not-for-profit hospitals charged just across town being 10 times what we charged, I thought, you know, we need to get this information out there. The word had already gotten around Oklahoma City amongst the uninsured population. If somebody didn't have insurance and they needed a hernia fix, they would just call. And I would arrange for them to see a surgeon, usually within 24 hours, and just horse trade with them, come up with a price, and we were done.
That was then. This is now. Clearly, free market health care and the entire health care insurance marketplace is being overhauled by Obamacare. In fact, the goal is probably to kill the entire health insurance industry. Why? So the government can take over and, in the end, go to a single-payer, complete government-run system. That is where all of this is headed. Joining me now from our bureau in Washington, D.C., president of the Market Institute, Charlie Sauer. There are a lot of Americans right now, Charlie, under the current system before Obamacare, who choose not to have health insurance, and they want to pay with cash. But now, all of that's out the window starting January 1st.
Yeah, I mean, a lot of the business to Surgery Center Oklahoma might change, but I'll tell you, actually, there is a way out of Obamacare that a lot of people don't talk about, and that's where Surgery Center Oklahoma gets a lot of its business, and that's third-party insurers or self-insurers. So a lot of banks throughout the Oklahoma, Texas region, Graham, they self-insure themselves, and what they do is they say, you know what, if you need a surgery and you go to the surgery center and have Dr. Keith Smith and his crew treat you, we're not going to charge you anything, and in fact, we'll put you up at a hotel around there. And they end up saving tens, if not hundreds of thousands of dollars. And so even under Obamacare, his practice is still going to flourish, not to mention the Canadians that fly in to see him. The last time I talked to Dr. Smith, I was with him for a couple of hours. He had 6 Canadians call in just about 8 hours to fly down to his clinic and get the surgery that they need. So there's actually, I think, some of this free market stuff's going to flourish. And there's also, to have Obamacare work, I think you mentioned this, they need the individual mandate and they need that fine to get people into the insurance marketplaces. But to get the bill passed, they didn't make the fine large enough to actually force people into insurance. So you have cash providers and concierge doctors that their business methods are still going to work even under Obamacare.
So let me get this right. First of all, you could choose to not get health insurance and then you would pay the fine. However, Charlie, we should note that the fine is progressive over the years. For each year you don't get insurance, the fine increases. I'm not sure how much it increases, but it does increase. But under this third-party insurance, a company would have its own insurance, self-insured, and that is allowed under Obamacare?
That is allowed under Obamacare. I actually saw a presentation last week. I'm not sure if I agree with it, but they called it the silver bullet for Obamacare. And that was this backdoor way to avoid a lot of the regulations and laws that are put in place by Obamacare. I don't see a lot of people that are going to run out and self-insure, but there is an exemption in Obamacare for religious shared ministries is what they call them, but church groups or religious groups get together and they share a pot of money and insure themselves. So those are exempted from Obamacare. These third-party insurers are exempted. And then there's just people that honestly don't care. So, I mean, they like their doctors enough. I know a lot of doctors who have just opted out from Medicare and Medicaid and still see patients that lose their benefit from Medicare or Medicaid, but they like the doctor so much they're willing to pay their really low cash prices.
You know, maybe that's the way you gut Obamacare. Maybe that's the way you stop Obamacare, and that is use these loopholes against Obamacare, because if enough people took part in what you're talking about, if every church in America, for example, all of a sudden started carrying its own insurance, that would gut the entire Obamacare system, because it wouldn't be able to sustain itself, because, as we noted, this is classic redistribution of wealth.
Yep. If you can't get the young people and you can't get the healthy people into the system, then it doesn't work. There's a practice that has these prices to make it make more sense. Under Obamacare, you pay basically the same price no matter what age you are. But Atlas MD in Kansas, if you are under 19 years of age, you only pay them $10 a month to go see them. And for that, they'll do blood work, urinalysis, basic tests, EKGs. You can Twitter them, email them. You name a basic procedure and they can do it. If you're 19 to 44, they charge you only $50 a month. And then I think it caps out at about $75 a month. But, I mean, you know, a little kid under 19 are not much to insure. But under Obamacare, that's where the money gets redistributed from the healthy young to the sick and old.
And the bottom line, it's, as Atlas Shrugged points out, it's the producers versus the takers here. That's what we're talking about.
Yeah, I mean, the people that I mentioned, Surgery Center Oklahoma, Atlas MD, and there's a couple of others that I'd like to talk about. But these people are innovating and taking care of patients. They put the patient-physician relationship instead of the government-patient relationship first. And you see a lot of people out there right now leveraging the strength of the government to force doctors to act in a certain way. But you have other doctors that just decide to opt out of the system. That's the government shutdown highlights these people because some of the government just stays home under a government shutdown. But these doctors are working. They are all making money, and they are taking great care of their patients.
And there's going to be a doctor shortage, because there's a lot of doctors who aren't going to put up with all this mess. That is for sure. Charlie, thanks for all that. Coming up next, turned away at our national treasures, compliments of the Obama administration, as the Daily Ledger continues.